The updated findings reflect kind of just further duration of evaluation, and so and that kind of supports, I think, some of our early findings where we saw a high rate of response and stable disease in patients retreated. So we see approximately 2/3 of patients having clinical benefit. And I think the really exciting thing and why this data is really kind of exciting for the field is that those patients that have stable disease or response really appear to be durable. And so we show that again with this data, this time with further follow-up, in that the majority of patients that have a response are still on therapy. So over 80% of patients with response are still on therapy, still maintaining that benefit. And then we see the same thing with stable disease. So if you have stable disease that kind of lasts over 4 months, the majority of those patients are still on therapy, still obtaining benefit from kind of stable disease. And so the further follow-up just kind of demonstrates the durability of benefit in these patients. And then the second kind of factor that we discuss at this presentation that we haven't before is looking at some of the clinical factors of relevance and biomarkers. And so interestingly enough, we show that PD-L1 expression is seen in kind of the minority of cases. So about 1/4 of cases have PD-L1 expression of kind of greater than or equal to 1%. But responses are kind of irrespective of PD-L1 expression. And additionally, we show that responses are kind of irrespective of BRAF mutation or a clinical history of Lynch syndrome. So for MSI patients, there's kind of 2 big categories. There's germline inherited Lynch syndrome, and then there's kind of sporadic or acquired kind of MSI-H. And so per the 2 different ways we looked at it with BRAF or the clinical history, it doesn't appear to make a difference in regards to kind of your response. And so we would kind of say from our data that in a large number of patients, 74, that irrespective of the reason you have MSI-H, you will benefit the same no matter what. And so pretty much any MSI-H patient has a chance of this kind of 2/3 rate of a clinical benefit from therapy. And there's not a population that we appears to not have a benefit or to have a greater benefit, at least from those biomarkers we looked at.